I found an ocean blue in my house, my living room. Ride the waves in my canoe, and you know that it saved me.
We can keep you healthy and care for you when you're not, right in your own backyard. Memorial Care Heart and Vascular Institute at Saddleback Memorial, because a lot is resting on your heart.
Well, welcome back, folks. You know, we always like to bring you a good medical segment from Memorial Care Medical Group, and today is no exception. Doctor on today, Dr. Irfan Khan, and welcome, sir.
Thank you.
You are certified in pulmonary medicine, but you are here to talk about sleep disorders.
That's
and
right.
how well, it affects a lot of people, and ways to, well, find out exactly what's going on with you. First of all, welcome, and you were saying that right before we got on here, that for the last several years, you've been in the cold climes of Fargo, North
That's
Dakota.
Very cold.
Yeah, you got smart and came out here.
Actually, I did my fellowship here at USC, and after I lived here for several years, I just couldn't let it go. I had to come back.
Yeah. Well, what you were just saying, it's what, about 5 degrees there is their high today?
Exactly.
Yeah, and of course we think it's cold today. We're only going to get up to the mid-50s, and as you know, we're all bundled up here today. Well, you know, sleep disorders affect a lot of people. Do you know about a percentage of the population where in some sort of sleep disorder, whether mild or strong?
Sure. I mean, depends on the type of sleep disorder, but almost 5 to 10% of population or more are affected by sleep apnea, which is a big problem because it was, in the past it has been kind of underdiagnosed, but more and more people are getting diagnosed with sleep apnea because, underdiagnosis will lead to more and more problems. So, so a majority, of sleep disorders are becoming more and more evident because of more testing.
Right, right. What are the, as far as the causes, are there certain causes as far as sleep? A lot of times people talk about either physical attributes or stress, of course.
Sure.
I think we all have gone under that where, we might miss a little bit of sleep now and then. So what are some of the main causes here?
Sure. I mean, you are absolutely right. It depends on the lifestyle of the patient and also depends on the physical nature of the patient. Stress of lives, exactly, and also their body habitus. People who are overweight, they are more predisposed to sleep apnea, for example. If they are not getting enough sleep because of the stress or work, it affects their daytime functionality because they're not getting enough sleep at night. And so the combination does lead to sleep disorders, absolutely.
And how do you know if you may be suffering from that other than just, well, I didn't sleep too well this week?
Sure. Well, for example, it really depends on what kind of sleep disorder they have. For example, if they have sleep apnea, they usually will complain of waking up in the middle of the night, choking or gasping for air. They might wake up in the morning with a dry mouth. In the daytime, they might be very underfreshed, sleepy. Their bed partner sometimes tells them that they kick during their sleep, or they snore loudly or stop breathing during their sleep for several seconds.
Right, and I know myself a long time ago, due to my snoring, my wife said, you gotta look in to see if you have a problem. And I went to a sleep center nearby here.
Sure.
It turns out, no, I snore. That's about it.
Right.
And I would wake up every day going, I'm rested. I don't know what your problem is.
Right.
And so I didn't have sleep apnea. I didn't have a problem, and I wake up rested 95% of the time. So no problem. Right. And I think what I'm kind of getting at here is if someone does have that episode of just not getting enough sleep, feeling tired, or every once in a while, I think we all wake up in the middle of the night, depending how we're sleeping, maybe we've got a little bit of cold, of coughing up something.
Sure.
you know, and you're worried, is this sleep apnea, is something going on? So what would be the first step? Is it something that you would tell somebody if they first talk to their primary care physician? Would some of the questions they would ask, is this once in a great while, or are you noticing this on a consistent basis?
Correct. So as you said, they need to talk to their primary care provider, and of course he or she will be able to give them the best information. It really depends on how long these problems have been there for. For example, if they have been snoring off and on, you know, occasionally, it might not be a big problem, but if the problems have been persistent for several years, for example, then that indicates a possible problem.
Right.
Also depends on how other problems have persisted. For example, if they are waking up tired and underfreshed or with a headache every morning on most days, or if they feel underfreshed throughout the day on most days, then that means that there is a problem.
Yeah, and if someone you find out really does have a problem, and whether or not it's on the sleep apnea side or just simply they are not sleeping soundly, how do these affect someone's health? I would imagine that just not getting enough sleep, exactly. That just in general, forget all the other stuff that may go along with that, is just going to make your day drag on. You're going to feel tired, lethargic, not think clearly.
Absolutely. And on top of that, you know, those patients who have, for example, sleep apnea, they will, there are short-term side effects and there are long-term effects. Short-term will be, like you mentioned, not feeling well in the daytime. They might run into accidents because they fell asleep while driving.
Right.
It might affect their social life because their wives or spouses complain that, you know, they snore loudly during sleep and it's affecting their own sleep, the partner's sleep. Long-term side effects will be heart problems, for example, you know, heart disease like heart attack, heart failure, or arrhythmias of the heart, or high blood pressure. Their diabetes might become uncontrolled. So all these other problems can occur if sleep disorder is not treated properly.
Is the sleep apnea, if you do have that, is that, as far as having the heart problems, is it, while you're sleeping, is it restricting some oxygen coming in?
Exactly. So there are two types of sleep apnea, but in the most common one, the obstructive sleep apnea, there's a obstruction to the flow of air in the airway. It could be in the throat, it could be in the upper airway, and because of the lack of oxygen to the brain and other parts of the body, that can lead to high blood pressure and heart diseases.
Okay, so you go to your primary care, they figure out this could be a potential problem.
Sure.
And you get prescribed, I guess you would call it, for a sleep study.
Right.
And I know Memorial Care has a sleep center, and it's down in San Clemente.
That's right.
What goes on? I mean, as I said, I had one, and they stuck all these things into my head, and it's kind of uncomfortable because you're in a strange room. It was like a low-rent hotel room. This was not theirs. This was somebody else's. I've heard now since then there's been a little bit more advances. But what would be a typical procedure, typical night for the patient going in? They come in at 9 o'clock or 10 o'clock at night, and what would happen?
Right. So when they come in, they will get instructions before the study. You know, okay, you come at this time, how to prepare for the study. Once they come, then the technician will guide them through the procedure. They will put different electrodes, like you said, on your scalp, on your chest to monitor the heart rhythm, the oxygen, everything. We have mics to monitor their snoring and video cameras to monitor their sleep positions, for example. And throughout the night, then we monitor them. So if most of the times what we do is we call a split night study. In the first night of the first part of the night, we monitor them, and if they have sleep apnea in the second part of the night, then they will be placed on a CPAP machine to see if that will control their sleep apnea, for example, if that's the case. And so in one night, we can actually get the diagnosis done and also recommend the appropriate treatment.
Okay, and as I said, when I took this several years ago, for me, there was somebody in there monitoring you all night long. Because I remember I got up because I had to go to the bathroom, and the guy was there. I mean, that is to take the stuff off. And then at the end, you know, it came back. He's going, "No, you're fine. You snore. That's about it.
Right.
You know, tell your wife to get earplugs. That's about it."
Right.
But you know, that was a necessary step so they could eliminate the problems. Now, are some of the things, you know, we hear about drinking coffee, having you know, having a drink of alcohol at 8 o'clock at night or something like that. I'm not talking about heavily drinking, but just something like that, a glass of wine. Should you calm yourself down just to get a good night's sleep?
Exactly.
You're watching something on TV and maybe it's some big police drama with a lot of action versus maybe the last half hour reading a book or whatever it might be.
Right.
Are these all?
That's an excellent question, actually. I'm glad that you asked that, because what happens 2 to 3 hours before the sleep actually does affect your overnight sleep. And trying to minimize your brain's interaction and the thought process to try to control that, minimize that, is very, very important. Watching TV just before going to bed is not a good idea. Bright lights is not a good idea, because then your brain, sleep center, gets to thinking that it's still daylight, it's still early, and so it won't shut down right away. And so you might be tossing and turning in bed for a little while then. Drinking caffeine or alcohol also are not a good idea, because just before sleep especially, because that can affect not only your sleep but also can worsen the sleep apnea.
Right.
And so it's advisable to have dim lights before going to bed. Don't drink any coffee, alcohol in the few 4 or 5 hours before sleep, so that you can get a good night's sleep, and try to sleep at least 7 to 8 hours daily.
Yeah, and that's good sound advice. You know, one other thing I heard about that, you know, a lot of the people that live here are retired, and there's not a need for them to get up, although they're hugely active, but at 5 o'clock to get ready for work.
Sure.
What about the folks that, you know, they're on that old style pattern where I got to go to bed at 10 o'clock at night no matter what?
Sure.
Should the people that can do this just stay up a little bit longer until their body tells them, hey, you know what, it's time to go to bed? Or, you know, again, people like us that have to be up, I know that I'm going to go up to bed at a certain amount of time, whether I'm tired or not. I just got to do it.
I think that's actually more appropriate to do. People who have a fixed routine of going to bed at a certain time and waking up at a certain time actually have more refreshing sleep than people who do not do that.
Right.
And if somebody has to wake up at 5 o'clock in the morning, if they don't go to bed till, let's say, midnight, they're only getting 5 hours of sleep.
Right.
So going to bed on time every night, same time, is actually much better than not doing that. And so you have to follow a routine, you have to develop a routine so that you can go to bed at the same time every night. And that's the circadian rhythm of our body.
Right.
That gets adjusted to that routine, and that's the most healthy form of sleep.
Right, right. And just whether or not you have to be up for something, for work or whatever, having that pattern is, and you know, that goes along with your eating habits and everything else. All right, well, if you want more information, the number for Memorial Care Medical Group is on the screen. You can see there 1-866-276-3627. And Dr. Khan is down at the Memorial Care Sleep Center in San Clemente, and it was great to have you on. And a very important topic, and just as you said, that if people think they have a problem, talk to your initial primary care physician and go from there. And you'll not know until there's a sleep study. They can talk to you for hours, but until you do this, you know, one thing, it may be a little inconvenient, but I can tell you from my case, it eliminated things that could have been there. So it worked. Doctor, thank you very much for coming on.
Thanks for having me.
All right, folks, we'll be right back with more Channel 6 News.
Family. Whatever you need, they've got your back. Like Memorial Care Health System, a family of healthcare providers. At Memorial Care, we're all connected. The finest hospitals like Saddleback Memorial, top doctors, medical groups, urgent care centers, in-store clinics, and more. No matter which one of us you visit, we're all up to date. We can keep you healthy and care for you when you're not, right in your own backyard. The family of Memorial Care Health System, investing in you.